Hello everyone, welcome back to my mental health awareness videos. I'm sorry I haven't uploaded in a really long time. It's just that I've been really busy with school and everything. I've got mocks coming up this week, so I've been really busy and I haven't had time to sit down and record. And also when I get home from school, the lighting's not very good and I can't use my torch or anything because my notes are on my phone. Firstly, I just want to say that last video I said that I was gonna upload a video every week, but I have now changed that to once a month because I've just been too busy. With the exception of this month, I will try my best to get it up within the first week of the month, preferably the first weekend, because weekends are when I have more time to film, because that's when I don't have any school. I've got the whole day to myself apart from the morning when I ride. So yeah. And also I just want to say that these are advice videos. I am not a professional or anything like that. I will try my best not to say anything that will be triggering, you know, like I kind of know where the line is, not to cross it and everything. And I kind of did this in the last video, but it wasn't that great. But I will be doing what the illness is, symptoms and treatment. I kind of did that in the last video, but I also did like personal experiences and personal advice and stuff like that just because I knew more about it. But if it's something that I don't really know a lot about, or I don't have any like personal experience with it, then I will just get my research from the internet and go from there really. So this month, as you can tell from the title, we are doing anorexia. For the next 3 months I will be doing eating disorders. So this month it's anorexia, then it will be bulimia, and then it will be anos. And then I will probably be doing depression, ADHD, stress, and I'm also at some point going to be having a feature video with Alice, you probably know her, and we're going to be talking about being gay, because Alice is gay if you didn't know that already. So she wants to help people out there because she knows how hard it is, and I know how hard it is for her. I know being gay isn't a mental health problem, but it can lead to it, so yeah, we'll see what happens with that. But hopefully that should be coming up soon. Maybe once we finish our exams we meet up more and we have more time, but I'll let you know in the future when I find out. I'm going to be talking about what anorexia is. Anorexia nervosa is an eating disorder that affects many women and a few men, but I think personally it's equal in men and women. Like, people will see it as the women's illness, but I think that's wrong because men can get it just as easily as women. Early diagnosis and treatment can improve the odds of recovery by a large percentage. Sometimes knowing the facts about anorexia will help family, friends and providers to recognise the signs and symptoms, so hopefully this video will be useful. Anorexia is more prevalent in the age group of the 15-year-old to the 23-year-old female, although a younger age group is appearing at an alarming rate. I saw a documentary about anorexia. It was a documentary about the private home called Rhodes Farm. You might have heard of it. It's kind of big in the UK or something. I didn't really agree with their methods, but you know, whatever floats your boat. But yeah, there were people on that show that were as young as 12 and 13, and when I was 12 and 13 I didn't even know what a mental health illness was, let alone what an eating disorder was, or have one. So that's pretty scary to think about. On the average, it is estimated that 1% of females in their teens and early 20s develop this eating disorder. Studies have shown that 10% to 15% will die of complications arising from anorexia. Peer pressure and an ever-increasing emphasis of today's model society seem to play a very real part in the development of anorexia. Let's be serious here. Let's just come back into reality. Those people on the magazines are photoshopped. beyond belief. Like, I don't know what part of them is real and what part of them is fake. Don't just like go to a magazine, oh, I want to be that woman, she's so skinny and perfect, because chances are she's not. Okay, let's just throw it back to the 50s or the 60s or whenever it was. I think it was the 50s and 60s, correct me if I'm wrong. But back to the times when Marilyn Monroe was really famous and everything, she was a size 14, which is actually an average size, but people these days seem to think it's fat, but you know, whatever. It's not, but whatever. Those people are stupid. But yeah, she was a size 14. She was seen as the perfect idol and the most beautiful woman. She was really beautiful. But I think we should just throw it back to the 50s and just start living like that again. Because there's nothing wrong with being size 14. That is a healthy size. Like, I don't know. Some people just don't see it that way, but you know, whatever. You're wrong if you think size 14 is fat. I think like size 18 would be classed as fat. Because typically seen in the female, the male anorexic is often misdiagnosed, which is kind of bad really. Feminism and all, and you're treating men like they can't have anorexia, you know, way to go women. People suffering from anorexia, even when dramatically thin, will see a distorted image when looking in the mirror and will see a very heavy person. An eating disorder is not just stopping eating and exercising loads. There is a more physical and mental side to it. Physical being the losing weight and stopping eating and the dieting, exercising. The mental side being the even though you stick thin and your bones are showing, you can't see it. Like, people seem to think that they're like over exaggerating or they're faking it and they're doing it for attention. They're really not. Like, it's just how they see themselves. They can't help that they see themselves as being really fat. You know, that's just what their brain's telling them. They don't register what they're actually looking like. So that's why people don't really notice until it's too late, especially with EDNOS, because that is eating disorder none other specified, which is basically like anorexia and bulimia like together, with they show like symptoms of both or whatever. I'll go into more detail when I do my video, but people don't really tend to know that they're like having an eating disorder because it's not really that obvious and stuff. And like even with anorexia, people, they like try and hide it, like wearing baggy clothes and stuff like that. So yeah, sometimes it can be like hard to tell. In attempts to lose weight, they may miss meals, eat very little or avoid eating any fatty foods, lie about what and when they've eaten, obsessively count the calories in food, lie about how much they weigh, exercise excessively, take appetite suppressants such as slimming or diet pills, make themselves vomit. You may notice they leave the table immediately after meals or have dental problems such as tooth decay or bad breath caused by the acid in vomit. People with anorexia often believe their value as a person hinges on their weight and how they look. They may think others will like them more or they will feel happier if they are thinner and see their excessive weight loss in a positive way. Yes, admittedly, there are some people out there that could do with losing a few pounds, but that's not what an eating disorder is. Well, it can be, like, I guess if like you do it like dangerously or like you do it like you just, I don't know how to put it into words, but like you just stop eating kind of thing. If you're like overweight, you just like stop eating or eat less and less. That could be like leading on to an eating disorder and develop into an eating disorder. People may try to hide how thin they are by wearing loose or baggy clothes, as I said before. Many people also practice a type of behaviour known as body checking, which involves persistently and repeatedly weighing themselves, measuring themselves such as their waist size, or checking their body in the mirror. People with anorexia also usually have low self-esteem or self-confidence. They may withdraw from relationships, become distant from family and friends, and lose interest in the activities they previously enjoyed. Anorexia can also affect the person's schoolwork or how well they perform their job. Eating too little for a long time can also result in physical symptoms such as bloating or constipation, headaches, feeling lightheaded or dizzy, feeling very tired, feeling cold, discoloured hands and feet caused by poor circulation, dry skin, hair loss from the scalp, abdominal pain, problems sleeping and brittle nails. So you may think being skinny is all perfect and everything, or it's like attention seeking, but would you really want to go through all of that just for attention? Like, I know I wouldn't want to lose my hair for attention. Don't know who would really. That's what people seem to misunderstand. Every mental health illness is for attention, you know, it's nothing to do with your brain really, but they don't realise that it actually is. Because some people out there are stupid. I keep telling you this, listen to me. Anorexia is an eating disorder in which a person starves their body due to a fear of being too fat or becoming fat. It is a very real disorder of a psychological nature. It often is part of a problem with perfectionism and the desire to control their environment. Someone told me, I can't remember who, but someone told me that it's normally people that like are perfectionists that develop eating disorders more easily. I'm not saying that everyone that has an eating disorder is a perfectionist, but they just like have their perfect image, and then there's them, and then they work to become the perfect image. I was talking about this with the priest when I went to confession actually. He wasn't the one that told me about it, we weren't talking about eating disorders. But I was just saying, there's this, like, it doesn't matter what I was talking about, but he basically said everyone has this ideal image. Jesus. It was so weird. This has nothing to do with anorexia, but he literally said that there was their perfect image, and then there was them, and then they like spend their whole life working towards to be that person, but then they never end up being that person because it's impossible. And basically just putting that into perspective of anorexia. What up? Families can support the person with anorexia nervosa by offering a stable and loving environment and being attentive to the person who has this disorder. By being supportive of the person with anorexia, family and friends will increase the chances of recovery. Coping strategies for anorexia nervosa require a great deal of patience, hope, and strength. To help the person with anorexia in making a recovery, you can be available to them and help them through by attending group and family therapy sessions. You can remind them that they are not alone in their efforts. It is impossible to start treatment as early as possible, particularly if someone has already lost a lot of weight, to reduce the risk of complications of anorexia. GPs will normally be closely involved in ongoing treatment, although other healthcare professionals are usually involved, including specialist counsellors, psychiatrists, psychologists, specialist nurses, dietitians, pediatricians, in cases affecting children and teenagers. Most people are treated as an outpatient, which means they visit hospitals, specialist centres, or individual members of their care team for appointments, but return home in between. In more severe cases, people may need to stay in hospital for a specialist centre for longer periods during the day patient, or may need to be admitted as an inpatient. Psychological treatment. A number of different psychological treatments can be used to treat anorexia. Depending on the severity of the condition, treatment will be for at least 6 to 12 months or more. Cognitive analytic therapy, CAT. CAT is based on the theory that mental health conditions such as anorexia are caused by unhealthy patterns of behaviour and thinking developed in the past, usually during childhood. CAT involves a 3-stage process: reformulation, looking for past events that may explain why the unhealthy patterns developed; recognition, helping people see how these patterns are contributing towards the anorexia; revision, identifying changes that can break these unhealthy patterns. CBT is based on the theory that how we think about a situation affects how we act, and that in turn our actions can affect how we think and feel. In anorexia, the therapist will attempt to show how anorexia is often associated with unhealthy and unrealistic thoughts and beliefs regarding food or diet. For example, thinking that putting on weight is the single worst thing that can happen in my life. Everyone I know thinks I am fat. If I finish the whole meal, then people will think I am greedy and worthless. The therapist will encourage the adoption of healthier, more realistic ways of thinking that should lead to more positive behaviour. The care plan will include advice about how to increase the amount eaten so weight is gained safely. Physical health, as well as weight, is monitored closely. The height of children and young people will also be regularly checked to make sure they are developing as expected. I don't think that people will take height into consideration because I am 5 foot and I weigh about 6.5 stone, I think, last time I weighed myself, and that is classed as underweight apparently. Only small amounts of food will be expected to be eaten at first, gradually increasing as the body becomes used to dealing with normal amounts. I went to a school counsellor and she was pretty crap because I was dealing with not eating enough at one point, and I told her this and she said, "You need to start eating." Do you not think I already knew that? That's not really helpful when that's not how my mind was thinking at the time. So claps to you, school counsellor, claps to you. The eventual aim is to have regular eating patterns with 3 meals a day, possibly with vitamin and mineral supplements. An outpatient target is an average gain of 0.5 kilograms a week. In a specialist unit, the aim will be to gain an average of around 0.5 to 1 kilograms a week. Okay, so thank you so much for watching this video. I hope it was useful in a way. Sorry I was trying to be as serious as possible, but sometimes my mind just goes all over the place and I just don't focus, so I hope I haven't offended anyone. But yeah, I hope that someone gained something from this, because that is what these videos are trying to do. And don't be afraid to DM me on Instagram if you want to talk about anything and just have a little rant or a little vent, or ask for some more advice, because you never know, I might be able to pull something out of the bag. But yeah, my best advice in every video is, if you are seriously concerned, then go and see a doctor, talk to someone. I am only a 16-year-old girl, not a miracle worker or a doctor or a professional, so I'm not your best bet. But I hope this video has helped someone and just gives you a bit more insight. And also to the people that, even if you're not suffering with an eating disorder, it might help you to understand more about the disorder, so you don't go off teasing anyone by accident, or unless your friend could be suffering, you never know. But yeah, I will see you next month. Only small amounts of food will be expected to eat. 1, 2, 3, 4. Did you not focus? Jeez Louise. Oh dear. Oh, completely missed. It was meant to bounce off the lens. Hey! Okay. I'm in a weird mood today. Probably not a good idea to do a serious video, but you know, whatever. We'll roll with this.